Well, for more reaction to the ceasefire, let's go to Melbourne doctor Bushra Othman in Amman, who's recently left central Gaza after working at the al-Aqsa hospital. Good morning to you, Bushra. Look, it's just wonderful to have you on the program again.
Nice to speak with you again, Bridget.
Tell us, Bushra, this is your second time in Gaza. What was this second trip to Gaza like for you?
So I spent 6 weeks in Gaza, based again at al-Aqsa hospital in the central district in Deir al-Balah, and I entered this time with the organisation GLIA. I think for me, what was most important, and people might remember from when I spoke to you guys 6 months ago, was that, I wanted to show the Palestinians in Gaza that there were people all around the world who would offer their physical and moral support to stand with them during these harrowing times. I think the scenes that I witnessed were even more harrowing than when I first went there. The scenes of destruction were infinitely worse. These are humans that have been pushed beyond the limits probably than any other humans around the world, and yet they still honoured us and are still working in the healthcare system to try to provide care to the patients that they see. And for me, I think I've left with a sense of even greater purpose that we really need to commit to being able to now helping them in the rebuilding phase.
What an enormous, enormous task. It's an incredible job you've done alongside your colleagues. Bushra, what about the ceasefire now and the post-ceasefire reality? Can you talk to us about, for medics, for nurses and doctors and all those working in what remains of hospitals in Gaza, what will the ceasefire mean for them?
Definitely been a bittersweet, I wouldn't say finale, but the news that's been received firstly on the Wednesday evening and then this morning. Firstly, elation at the fact that the destruction and the bombing and the grief will temporarily lessen. And I say bittersweet because finally people will be able to really understand the depths of loss and sadness and grief that they've experienced for the last 15 months. I think finally, slowly, they'll be given the opportunity to psychologically, mentally, physically and emotionally understand what's occurred to their family members, to their land, to their homes, to their people over this time. People are very elated at the opportunity to be able to be reunited with family members, to being able to try to head back home. But on accounts of that, their homes are rubble. A lot of towns have been wiped to smithereens, but yet that sense of wanting to go back, even if it's to put their tent on the remains of what was once their home, they're still looking forward to that. In terms of the healthcare system, it's going to be an enormous task to trying to being able to provide care for the hundreds of thousands of injured, not only patients that have suffered from trauma from the war, but also patients with chronic conditions, cancer patients who haven't received any form of treatment for the last 15 months. I've got a colleague's baby brother who's 5 years old, who's just been diagnosed with acute leukemia. If it wasn't for the news of a temporary ceasefire, there might not be any hopes of even trying to get him out to receive care. And so finally, there's a little bit of hope in the people and in the area that they'll be able to actually try to begin their lives again.
It sounds like, Bushra, these trips to Gaza have really changed your life.
Yeah, and I think, I probably speak on behalf of every single person who's entered Gaza in the last 15 months in particular. The people there have shown real honour, real perseverance, real strength and courage to be able to survive what no human really should be able to survive, what's being done to them by other humans. And also they've shown us really as healthcare workers their ability to being able to continue. And really my hats go off to them. I've learned so much from them and they've all become like family and friends. And so, I can assure you that anyone who's been there once, who's been there twice, will definitely want to continue and go back there to stand with their family and friends and colleagues.